Hello and welcome back to America's Forum here on Newsmax TV. We're continuing the conversation. America's Forum here on Newsmax TV. We're continuing the conversation right now with Dr. Scott McFarland, medical director and guide, New York Times best-selling book. Guys, great to have you back with us.
Thank you.
Thanks, John.
Great to be here.
All right, something we can talk about for our wives, our girlfriends, our moms, our grandmas is this issue of mammograms and breast cancer. It was thought at one point that you had to have a mammogram to prevent breast cancer, but research says maybe that doesn't always bear out to be true.
Self-exam is still probably the best diagnostic tool. You're more aware of your body than any technician, or any radiologist ever will be. Then ultrasounds can probably ultrasounds become the definitive diagnostic test when mammograms are equivocal.
Yeah, and Nick, this is a pretty controversial topic. What are you finding in your coverage of this?
Well, the real question, I think, is for younger women. Is an annual mammogram a good, over 50, over a certain age, right? A regular mammogram is recommended. It's for younger women where they don't really see the long-term benefits. So I think that's the more difficult challenge, long-term benefits. So I think that's the more difficult challenge for women who are in their 40s, for instance, or even in their early 50s. Your mother, your sister, an aunt had breast cancer. It isn't always clear. Had breast cancer. It isn't always clear who should get a mammogram and who will benefit. And
how does these BRCA tests and the genetic testing that's going on and the preventative mastectomies that we're hearing a lot about as well?
That's kind of like throwing the baby out with the bathwater sometimes. I think and they prey on fear, and I think it's kind of unfortunate because there's good enough testing now that I think that it is probably safe not to have both breasts removed in anticipation, of inevitable cancer, because cancer is not inevitable.
And I imagine that makes it a little difficult for you when somebody like Angelina Jolie, somebody who a lot of women look up to for her beauty, has a procedure done like this.
Yeah, I think celebrities have a responsibility
like this.
Yeah, I think celebrities have a responsibility to do responsible things.
But the genetic component of this is BRCA1 and the BRCA1 testing seems to me to be at least, if you don't take a radical step like a double mastectomy, there are ways to know what your risks are and manage them. You maybe closer monitoring, maybe you worry about things like exercise and diet and things that we know are preventive and can be helpful.
Good point.
Another topic we can talk about that's getting a lot of attention right now, and that's Bob Costas, who has now been sidelined at the Olympics. A lot of people have seen the unfortunate picture of Mr. Costas with bloodshot eyes, wearing glasses. Got to give him credit for trying to play through the pain. But Dr. McFarland, pink eye is something that I remember from being a little kid at school, and everybody getting scared when somebody gets pink eye. You don't hear about it every day from a newscaster. Tell us exactly what pink eye is and how people get it.
It is. In his case, I'm not sure it necessarily was because when it started out in one eye, and somebody who wears contacts most of the time, that's the danger. Wear contacts, you only get oxygen to your corneas through the outside world. Your corneas are clear because they have no blood vessels. So you wear contacts, you seal off that area for a prolonged period of time. Okay. Corneal ulcers are the most easily infected, and that's a bacterial infection. Epidemic keratoconjunctivitis, conjunctivitis, they're usually viral. Keratoconjunctivitis, they're usually viral. But usually attacks both eyes pretty much simultaneously.
That's what led him to it.
And so earlier in the week we saw that picture of the brown water that some of the press were dealing with. I don't think Bob Costas has to deal with those types of issues when they get, I'm sure he gets a nicer hotel room than your rank and file member of the press. But can you get this if the water is infected with like an E. coli type bacteria? Is that something?
E. coli would be extraordinarily rare. It's usually a coliform, GI tract bacteria or urinary tract.
That's what I meant to say. I'm sorry. The fecal chloroform bacteria.
Yeah. The EKC, epidemic keratoconjunctivitis, is purely viral, transmitted from one person to another. Particularly, make sure who you butterfly kissing. We can get that close. But usually, it's transmitted by your own hands. Then you rub your nose. You rub your eyes, and that virus is transmitted. And it is the one thing. I've been in emergency medicine 30 years, only had one doctor call out one time, and that's because it was so epidemic they wouldn't limit it. One time, and that's because it was so epidemic they wouldn't limit it in the emergency department.
All right, one more topic real quickly. Let's talk about Tom Brokaw, recently diagnosed with multiple myeloma. We wish him the best. What kind of prognosis do you think he has? The disease in general, this type of cancer, how's the diagnosis for most folks?
The earlier you make the diagnosis in any disease, the better chance you got to treat it. And it's the side effects of it, the bone demineralization and other catastrophic conditions.
All right, thanks a lot, Dr. McFarland, Nick Tate. So thanks for being with us. We have some tweets we want to get to from our viewers. Let's go ahead and put those up on the screen right now. We have one from Pro F Pundit. Obamacare needs to go. It's ruining our country. Thanks so much, Pro F Pundit, for writing in. Next up, we also have one from Twins Opinion. Obamacare is a burden. How would you explain the effects from penalties families will face that do not take the health care coverage? Maybe that's a question best answered by you, Nick. Have any answers for those folks?
Well, I think there are significant impacts on folks. I mean, that's the issue. Insurance is one of those things that's always good to have, but if at some point you have to evaluate what is it costing me and what am I getting for it?
Yeah, and we hear so often that elections have consequences. The question is the delay, the people who are getting kicked off their plans, the doctor shortages. What is the next thing that's going to make people upset? And I would imagine we'll see some of that when the elections come around, and potentially more changes ahead for the healthcare industry as a result of those elections as well. Gentlemen, we'll have you back soon. Fascinating discussion on a whole range of healthcare issues. I feel like we learned a lot and gave our viewers a lot to learn as well.
I hope so. Thank you for the opportunity.
Thanks, John. Appreciate it.
My pleasure. When we come right back, we'll be talking with Tim Colley, managing editor of Newsmax.com. We'll talk about some of the biggest stories on Newsmax.com today, plus what Tim and I are watching on television and maybe what you should be watching too. We'll be right back after this.